Welcome to the DJUSD Return to Campus Staff Health and Safety Training. I'm Amy Stacy, one of the district's school nurses and your host for this training. Health and safety are of the utmost importance now more than ever. During this training, we will cover current best practices that have been implemented district-wide to prepare sites and staff for a return to campus. We want you to know that the slide deck used during this training will be provided with live links to embedded videos and content. So let's get started. The California Blueprint for a Safer Economy continues to guide the school reopening process based on 4 tiers defined by the 7-day daily COVID-19 case rate per 100,000 population and test positivity in the county. The DJUSD School Board has established specific conditions that must be met to move forward with a hybrid return to campus. The motion has 2 important components. The first includes the conditions for a return to campus that are within the control of DJUSD, such as asymptomatic testing for students and staff, and classroom set up to ensure adequate distancing and ventilation. The second includes conditions outside the control of DJUSD, such as the county tier status and second-round vaccination of staff. Monitor the district's website for the most recent status. This data changes often. The most updated information can be found on the Yolo County COVID-19 dashboard linked above. Along with paying close attention to health conditions in the community, we also must prepare staff, students, and our school sites for a return to campus. This includes widespread deployment of personal protective equipment such as masks, face shields, and gloves for staff and students. We have a large amount of hand sanitizer available and portable hand washing stations for each school site. Students and staff will have access to sinks and portable hand washing stations. Classrooms, multipurpose rooms, gyms, work areas, and offices will have access to hand sanitizer stations. Classrooms and restrooms will be closely monitored to ensure adequate hand washing supplies. Please report any missing supplies to the site administrator or custodian. We are installing hydration stations on all campuses and encourage students and staff to bring their own water bottle. Ventilation has been improved with the installation of MERV 13 high-grade air filters in all classrooms. And we are purchasing air purifiers for each classroom. Signage is posted on campuses to remind students and staff of the need to wear a face covering, physically distance 6 feet apart, and practice frequent hand washing. We have implemented enhanced cleaning measures, which includes daily disinfection of the front office, bathrooms, staff workrooms, health offices, and classrooms, with particular attention to high touch points such as light switches, doorknobs, handles, desks, tables, countertops, dispensers, faucets, and sinks. Custodial staff are carefully monitoring the soap and paper towel supply in restrooms and are replacing frequently. If you notice supplies need to be replenished, alert the office staff or custodial staff directly. All rooms being used by staff will be disinfected daily. We want to continue to remind you that staff must report all potential cases of COVID-19 to the district using the COVID-19 reporting at djusd.net email address or by calling the COVID-19 response line at 530-235-6137. This includes staff or student exposure to a positive or probable case. When in doubt, report the case. Health services staff will contact the reporter and provide education and guidance on health issues and protocols, and will notify Yolo County Public Health of positive or probable cases of COVID-19. The health department is responsible for all aspects of contact tracing in the community. However, health services will support contact tracing in the school environment by determining who in the school has potentially been exposed. DJUSD will follow Yolo County Public Health guidance to determine if groups or school sites need to be quarantined and communicate with affected staff and families. Additionally, health services will work with quarantined or isolated individuals and/or families on a plan for return to school. One of the most important things we can do to protect staff and students is to wear face coverings when on campus. All DJUSD staff and students in preschool through grade 12 are expected to wear a face covering at all times on campus, when indoors and also outside. Face coverings should be worn during exercise, even with heavy exertion. Face coverings may be removed for eating, but physical distancing must be maintained. If you become aware of a student who is unable to wear a face covering due to a documented health condition, please direct the parent to contact the school nurse immediately. If a student cannot wear a face covering due to a medical issue, staff must wear a surgical mask, and a face shield is also recommended. For any questions or concerns regarding a student who cannot wear a face covering, please contact your administrator or school nurse. An employee's face covering may be removed briefly during instruction to provide language acquisition services, but the employee must wear a face shield with drape. This is for the safety of both students and staff. The face covering must be put back on as soon as instruction is complete and before leaving the classroom. Face coverings must cover the nose, mouth, and chin. Secure with ties or straps and have at least 2 breathable layers. The face covering cannot have a valve, which is typically a raised piece of plastic on the front or side of the mask. Valved masks are not considered a face covering per county health orders, as droplets are released through the valve, putting others nearby at risk. If a student arrives on campus wearing a valved face covering, please provide them an appropriate face covering. Face coverings should be cleaned after 1 day of use. If you see a student or staff member who is not wearing a face covering, wearing a face covering inappropriately, or wearing a face covering that has a valve, please remind them of the requirements. As members of the DJUSD community, if you see something, say something. Now let's watch a short video on the use of cloth face coverings.
It's important to wear cloth face coverings when you're out in public and around people who don't live in your household. Face coverings act as a barrier to help slow or reduce the spread of COVID-19. Check with your school for information on face covering policies. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Fit it snugly against the sides of your face, but make sure you can breathe easily. Don't put the face covering around your neck or on your forehead, and don't touch it. If you do, wash your hands. Never share or swap face coverings. When you get home, carefully take off your face covering by stretching the ear loops or untying the strings behind your head. Fold the outside corners together and put it aside for washing. Then wash your hands. Cloth face coverings should be washed and dried after use each day. Label your face covering with your name or initials. Bring a backup in case it's needed. In addition to wearing cloth face coverings, remember to follow everyday healthy habits. Wash your hands often, stay 6 feet away from others, and stay home if you're sick. If you have any questions about wearing a face covering at school, contact your school nurse, a trusted resource for students, parents, and staff.
Hand washing is one of the best ways to prevent the spread of germs. Students and staff should wash their hands with soap and water before leaving for school and when they get home. Please ensure everyone sanitizes hands when they enter and exit the classroom. Have hand sanitizer readily available for use. Additionally, please remind students to wash hands with soap and water prior to eating, after using the restroom, and when hands are visibly dirty. As students may be on campus during lunch or snack time, staff should develop a structured routine for students to wash hands prior to eating. Now we're going to watch a short hand hygiene video.
Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Wet your hands with clean running water. It can be warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Wash the fronts and backs, wrists, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. You can sing the ABC song once, or the Happy Birthday song twice. Rinse your hands well under running water and then dry them with a clean towel, or air dry them. Turn off the faucet with a towel. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply the sanitizer and rub your hands together until they're dry. This should take about 20 seconds. Wash your hands before you eat or touch your face. And after you use the restroom, go outside, blow your nose, cough or sneeze, or touch your face covering. Remember to follow everyday healthy habits. Wear a cloth face covering, stay 6 feet away from others, and stay home if you're sick. If you have any questions, contact your school nurse, working on the front lines of the COVID-19 pandemic in schools.
Staying 6 feet apart at all times is an important component to reducing the spread of communicable diseases like COVID-19. Please monitor your proximity to others at all times. If you must get closer than 6 feet to provide a student support, protect yourself and your student by wearing the appropriate face covering and ideally also a face shield. Everyone should bring a reusable water bottle to school daily to fill at designated hydration stations, as water fountains will be inaccessible. Students should be provided with their own supplies to limit sharing, and they should not share any personal items. This includes pens, crayons, pencils, paper, and manipulatives used in the classroom. Students should bring their own supplies to campus each day, or supplies may be stored in the classroom separately and labeled with the student's name. Items that must be shared should be cleaned between each student. And now, a video made by school nurse Laura Burke on physical distancing while at school.
Hi, I'm Nurse Laura. We're going to talk about physical distancing while you're at school. But first, I want to talk to you about sneezing. A sneeze is a powerful force of nature. One sneeze can produce up to 100,000 droplets and travel at 100 miles per hour for up to 6 feet. And while that is impressive, the cough isn't far behind. A single cough can expel almost 3,000 droplets and travel at 50 miles per hour. In fact, it's the favorite mode of transportation for most viruses, including COVID-19. 6 feet is about the distance that a respiratory droplet travels as a result of a cough or sneeze. That's the reason we practice physical distancing, or staying at least 6 feet apart from others at school. It helps to slow the spread of the disease. So how do we do that? Well, nature has provided us with an easy measuring tool, our arms. The average adult arm is approximately 3 feet long. If you and the person next to you hold your arms out straight and you can't touch, then you're likely about 6 feet apart. If you can touch, it's time to back up and give yourself some room. Of course, separation goes against our nature. It's normal to want to hug your friends or stand close to look at something on someone's phone. But right now, we've all got to do our best and practice physical distancing. So what does physical distancing look like while you're at school? You might notice that desks are spaced farther apart, and there may also be designated spaces for you to eat lunch, as well as directional signs to show you where to walk or where to stand when waiting in line. Group gatherings will be discouraged during the school day, which means no assemblies, and we may not be using lockers for a while. But don't worry, there will be a lot of the same things you're used to. You'll still get to learn and see your friends. While school may be a little different, we're all in this together. Thanks for practicing physical distancing so that we can all be safe.
Everyone is expected to screen themselves for illness prior to arriving on campus each day. Please use the daily illness screening checklist found on the district's website for guidance. It is important for everyone to stay home if they experience any symptoms of illness. Staff should alert their supervisor of their absence, call or email the district's COVID-19 reporting line, and contact their healthcare provider for guidance. Employees who test positive for COVID-19 will receive 10 days of leave. Staff are expected to provide test results in order to receive the extra leave. If COVID-19 is ruled out, staff may return to campus 72 hours after the fever is resolved without the use of fever-reducing medication and other symptoms are improving, or when cleared by health services staff consistent with the most recent public health guidance. And now, a video on how to screen yourself for illness. Hi, I'm Nurse Amy. Let's talk about how to screen yourself for illness before coming to school each day. As you probably already know, COVID-19 causes symptoms like fever, chills, cough, body aches, shortness of breath, sore throat, sudden loss of taste or smell, diarrhea, nausea or vomiting, fatigue, headache, nasal congestion, runny nose, or poor appetite. It's important to self-screen for symptoms every day before leaving home. This checklist provided by the district covers risk factors and has instructions on what to do if you have been exposed or if you might be sick. If you have had close contact with anyone diagnosed with COVID-19 within the last 14 days, check yes. That's a risk factor. Check in with yourself. Have you had any of these symptoms in the last 72 hours? If so, check yes. And finally, take your temperature. A fever is usually a temperature of 100 degrees or greater. It's a sign the body is fighting off an illness. But sick people may not always have a high temperature. If you look pale, flushed, or sweaty, or if you feel tired or weak, these can be signs of illness. Scientists have found kids and teens can be infected with COVID-19 and contagious, but may not show any symptoms or may have very mild symptoms that can feel like a cold or the flu. They may not have a fever. Some only have stomach problems. If you don't feel well, you should stay home, rest, and watch for new or worsening symptoms. Your parent or guardian should report your absence to the school and call your doctor. COVID-19 may not be the cause, but it's better to be safe than sorry. So, what if you have seasonal allergies or asthma? If you have allergies or asthma, some of the symptoms are similar to those of COVID-19. But allergies and asthma are not contagious, and it's okay to go to school. Please make sure the school nurse knows you have allergies or asthma. Manage your symptoms with maintenance medicine, and if you have an emergency inhaler, please carry it at school. Any student who has symptoms at school may be screened for COVID-19. The student will be allowed to rest for at least 10 minutes, and if symptoms don't improve, the student will go home from school. The school nurse will follow up with the family and public health to provide support and information. Let's review. If you stay home sick, your family should report symptoms to the attendance secretary and call your doctor for guidance. You should not return to school until you've been fever-free without the use of fever-reducing medicine for 72 hours. That is 3 days at home without a fever, because even after a fever is gone, you can still infect others, especially when coughing, sneezing, or blowing your nose. Taking care of yourself by self-screening every day and staying home from school if you don't feel well helps everyone stay healthy. Thanks for watching, and see you at school. Students and families are also expected to self-screen for illness each day before school. All families have been provided education on how to self-screen and how to screen their child for illness using the daily illness screening checklist. When students arrive at your classroom, please greet them at the door and do a visual screen for signs of illness using the classroom screening flowchart for illness and injury as a guide. Ensure that students clean their hands with hand sanitizer or soap and water upon arrival. If a student appears ill or reports that any household member is ill or has a positive risk factor, the student must be immediately provided with a surgical face mask and to put on over their face covering and directed to the isolation tent. Young students should wait outside the classroom door for health services staff or the designated assessor to arrive. Notify the office regarding the student's illness and/or risk factor. When a student is sent to the isolation tent, staff will follow policy number 40, COVID-19 on-site isolation and screening for when students and staff become ill at school. The school nurse, administrator, or trained designee will utilize illness screening guidelines to safely assess the student for illness and send home as needed. Health services staff will then follow up with the family to provide education and guidance. All staff who will be assessing students for illness at the isolation tent must receive training from the school nurse and review the first aid assessment for COVID-19 training available on the district's Health Services Staff Training webpage. Staff who become ill while at school must immediately place a surgical mask over their face covering and contact their supervisor. Staff who are ill must leave campus immediately and should alert the district's COVID-19 reporting line at covid19reporting@djusd.net. When reporting the illness, please include your name, phone number, school site, and any symptoms you are experiencing. Once you leave campus, you should self-isolate at home away from other household members and not return to campus until cleared. The district's COVID-19 Healthy Campuses website includes the most recent guidance on self-isolation and when it is safe to return to campus. Seek medical attention immediately if you or another staff member are experiencing severe symptoms such as trouble breathing, bluish lips or face, new confusion, persistent pain or pressure in the chest, or inability to wake or stay awake. Tell emergency medical services that you or the staff member is experiencing severe symptoms consistent with COVID-19. For more information on the district's plan and procedures to protect staff from COVID-19 illness, please review the district's COVID-19 protection plan. To help ensure physical distancing in the classroom, students should sit 6 feet apart. Place desks and tables to maximize space between students and mark any seating that will not be used. Position classroom air purifiers according to manufacturer's instructions to maximize air exchange within the room. To improve classroom ventilation, open at least one door or window as weather and air quality permit. Report any ventilation issues, such as concerns regarding your HVAC or air purifier, to your site administrator. Your classroom will be set up with a health station that is stocked with the following supplies at a minimum: hand sanitizer, surgical face masks, including pediatric surgical face masks for elementary classrooms, gloves, face shields as needed, a baggie of Band-Aids, and the double-sided classroom screening flowchart for illness and injury. As much as possible, minor injuries should be treated in the classroom. Please let your site secretary know if you need additional supplies for your classroom health station. If you have additional questions about the classroom screening flowchart or health station supplies, please contact your school nurse. Signage regarding the proper use of face coverings, physical distancing, how to stop the spread of germs, and hand hygiene are also required in every classroom. The district has stocked multiple forms of personal protective equipment, also called PPE, for staff to use, from surgical face masks and gloves to face shields and disposable gowns. If you need PPE restocked in your classroom, please contact your site secretary or school nurse. To help prevent the spread of contaminants, it is important to know how to properly put on and take off the various forms of PPE. So let's watch a video on how to safely don and doff PPE. All right, let's talk about personal protective equipment, or PPE. The district has provided us with disposable gowns and face masks. We also have face shields. There are two different types, one with a drape and one without a drape. And we also have our gloves. So there is a proper order to put on PPE. First, we start with washing our hands. So I'm going to sanitize my hands before I do anything else with the PPE. The first piece of equipment I will don is my disposable gown. It goes on opening to the back, and there are little straps to tie in the back. Before I do that, however, I'm going to pop my thumbs through the paper here in order to hold the sleeves down when I put my gloves on, because I don't want any skin showing. So now I'm going to tie my gown in the back, and after I get my gown tied and I'm all covered up, I will move on to my medical mask. Okay, with a medical mask, you want to try not to touch the front or the inside when you're putting it on. You'll first wrap it around your nose, and then you can loop over your ears, and then pull it down over your chin, just like that. Okay, and after I have my medical mask on, I am going to use my face shield next. So, face shield goes on like this. We want it down all the way under the chin. We don't want to wear it up like this, like I've seen people do. Not here. All right, so I have my face shield, my face mask, my gown. Lastly, I'm going to put on my gloves. All right, once I get my gloves on, notice my sleeves have stayed in place, and I am fully protected with my personal protective equipment. After I'm finished, I'm going to show you now how to take off your PPE or doff the PPE, because there's a process for that too. So first of all, I'm going to start with the dirtiest parts, my gloves. So I'm going to use glove and glove technique, which means I fold my first glove inside out and wrap it into my second gloved hand. And then I'm going to take my hand and slip it inside the second glove, pull that off inside out as well, so I have all the germs inside the gloves and I can dispose of the gloves. Next, I'm going to remove my gown, and I want to try not to touch the outside of my gown just in case there are contaminants on the gown. So I'm going to untie it and then wrap my hands up behind and kind of roll the gown off inside out. All right, rolling it inside out and into the trash with that too. Now, before I take off my face shield or my mask, I want to make sure I have clean hands. So I'm going to sanitize my hands again. All right, now that I have nice, clean, sanitized hands, I will remove my face shield. Try not to grab the front of it. Remove from the back. And the same with my mask. I don't want to touch the front of my mask, so I want to reach around to the ear loops, remove my mask, and that goes in the trash as well. So at this point, I want to wash my hands, but with soap and water, not hand sanitizer. So now I'm going to go wash my hands with soap and water. And I also want to clean my face shields. These are cleanable with the QT Plus that the district provides. And so please watch our video on how to use QT+. Thanks. Students may be nervous about coming to campus. Prior to starting class, it may be helpful to explain to the students how you will keep each other safe while at school. This includes everyone keeping their face coverings on and staying 6 feet from others. Talk about the use of hand sanitizer and hand washing and any specifics about your classroom, such as assigned seating, personal school supplies, water bottles, and backpack storage. Students should continue to submit their work electronically as possible. To build community in the classroom, encourage students to follow safety practices and health guidelines for the benefit of each other, not only while at school, but also at home. School nurses have developed health and safety training for students and families, including the information regarding face coverings, hand hygiene, physical distancing, and screening for illness covered in this training. Health and safety education based upon the most recent federal, state, and local guidance will be provided to all students and families at the start of in-person learning. In order to promote physical distancing and discourage gathering on campus, limit non-essential people on campus. For younger students, escort your class to the parking lot to await pickup. Parents may not congregate in front of the classroom and should wait in their car or on the site's entry sidewalk when dropping off or picking up their student. Parents are also expected to wear a face covering and maintain physical distancing when dropping off and picking up students from school. If you see parents engaging in unsafe behavior, please remind them of these rules and report concerns to administration. Consider removing tables and chairs from staff rooms to discourage gathering for meals or breaks. If you see staff gathering inside, please remind them of the importance of distancing and encourage them to move outside. The classrooms and offices will be disinfected nightly by custodial staff. However, you may clean large shared items between uses with a district-approved cleaner provided by maintenance and operations. Additionally, you may use QT Plus disinfectant spray and paper towels to clean surfaces in the classroom. A reminder, staff must review the Target Solutions training on proper use of disinfectants to be able to use QT Plus. Please contact Danielle McCaslin in Personnel Services to request the training be assigned to you. Custodial staff will stock your classroom with QT Plus and paper towels once the training is complete. For additional staff health and safety training resources, including a QT Plus tutorial video, please visit the Health Services Staff Training page on the district's website. The staff training page can be accessed on the left side menu bar. For more information regarding COVID-19 related health and safety practices, please visit the district's COVID-19 Return to Campus website. We have covered a lot in this training. To review the slide deck and many helpful links at any time, visit the district's COVID-19 Healthy Behavior Staff Education page. Reach out to the site administrator or school nurse if you have any questions about the content in this training. Thank you for helping our community return to school safely.